Thank you, Elizabeth, and thank you for the organizing committee to give me the possibility to present my work. So, of course, I have no disclosures. So, my topic is burning out the TLL engine. And NADK is a new therapeutic target in T-cell acute lymphoblastic leukemia. So, T-cell acute lymphoblastic leukemia, or TLL, is an aggressive cancer that is most common in children but also affects adults. TLL remains fatal in 50% of children and 50% of adult cases. And there is a real unmet need for new treatment in TLL. So most cases of TLL are driven by mutations in the Notch1 related gene, and we were set out to identify therapeutic vulnerabilities of Notch1 driven TLLs. To find these new therapeutic targets, we performed CRISPR Cas9 genome. So the CRISPR Cas9 genome-wide screens the genes for genes that TLL relies on to survive. So we use this specific pipeline to determine which genes are essential for the TLL to survive. We then isolated the genes that are specific to the Notch1 mutation and the Notch1 driven TLLs, and then understand the mechanism and test therapeutic potential. So we identified the metabolic gene NADK as a new therapeutic target, and the mechanism is the following. So once you have an activated Notch, this one will push the TLLs to proliferate by activating different programs in the genome. And this proliferation of the TLL creates a lot of byproducts. These byproducts, in this case, a reactive oxygen species, or ROS, are toxic for the cells. So in that case, Notch is also going to activate NADK that will then produce different substrates that will neutralize the byproducts in the leukemia cells. So in that case, the TLLs will be able to proliferate. And if you target specifically NADK, you are choking the TLL cells and they will stop proliferating. So preclinical studies show that genetic and chemical inhibition of NADK stops the TLL cells from growing in vitro and in vivo, and this without any significant toxicity. So in conclusion, NADK is a promising therapeutic target in TLL. There is an available inhibitor, thionicotinamide, but unfortunately, it's not powerful enough for clinical use. So we are looking and starting the development of new inhibitors to test alone and in combination with standard chemotherapy. So I would like to thank the different collaborators that have participated in this project, and also the different funding bodies, and your attention, of course. Thank you.
Thank you very much, Etienne.
Hi, Neil Osterweil with Hematology News. So, two questions, please, about potential interventions. One, what would be the off-target effects of inhibiting NADK, or inhibiting this, in this case, Notch, that you might see in other cells?
So there is actually two versions of NADK in the cell. There is a cytoplasmic one in the cell and one in the mitochondria. So the Notch-driven TLL seems to be specifically relying on the one in the cell, so the cytoplasmic one. So the normal cells are not at all affected because the one in the mitochondria that is completely different in aspect and structure, but still does the same job, is compensating for this lack.
And in case of this, the available inhibitor that you say is not powerful enough, thionicotinamide, correct me if I'm wrong, isn't this in the family of insect repellents and insect poisons?
No,
No,
it has
different
nothing.
thing.
No,
Okay.
it's a completely different thing.
What kind of agent is it then?
So it is an agent that is going to bind to the protein itself and blocks it from being active.
Thank you.
Perhaps I might just add one other question. The Notch mutated TALLs are the ones that do well. So shouldn't you be concentrating your efforts on the non-Notch mutated
Yes,
cases?
that's, let's say, follow-up studies. The interest in Notch was the fact that it represents 70% of all TLLs. And there are still some patients that are not, let's say, reacting to treatment or resistant to treatment. And for these patients, there's unfortunately no solutions. But let's say it was the low-hanging fruit in this case. And of course, this technology can be applied to a lot of different leukemias and a lot of different cancers.
So do you think it's specific to, you presented the model as if it were specific to
Yes.
Notch-driven, but are you mean that it might be appropriate for Notch-driven other cancers?
The CRISPR Cas9 system.
Oh, okay.
Yes,
Yeah.
sorry.
Okay,
Should have precise.
great. Thank you.